everyone. Good afternoon to all of you. I'm Sayukta from Beautiful Spotless Skin team, and I'm sure all of you must be keeping good health. Hair is the first thing that people normally notices about you. A great hairstyle can give you the personality boost you require and doing well in both personal and professional fronts. Black, luxurious hair is the crowning glory that you would never want to take off. But have you noticed many people, especially young generations, started developing gray or white hair quite early in life? This is scientifically known as premature graying of hair. It starts before 25 years of age and it can severely, affect the self-esteem of an individual. It can be a shock to find your first gray hair on your head, especially if you are only in your 20s. The prevalence of premature graying of hair was found to be as high as 27.3%. Thankfully, effective hair treatment and early consultation from the expert can control this process, but what remain the concern is the awareness of this hair concern. We are here to know more about premature graying of hair from an expert. So let's connect today with our expert, Dr. Chanchal Choudhary, live from Noida, to make us aware on premature hair graying. Dr. Chanchal Choudhary, an esteemed consultant, cosmetologist, and dermatologist, brings over 15 years of extensive expertise in medical dermatology, dermatological surgery, cosmetic dermatology, and hair transplantation. Her academic journey includes post-graduation from Dr. D.Y.Patil Medical College, Pune, and senior residency at Behl Skin Institute. With a wealth of knowledge and Choudhary is a valued professional in this very field. We extend our sincere gratitude to you, Dr. Chanchal, for gracing us with your presence today. It is indeed a pleasure to host such an distinguished expert and such a pleasure to have you with us.
Yeah, there's a little break in the conversation because the network problem was there. So
Yes, yes.
thanks for the welcome. And yeah, we can start.
So today we are going to talk about premature hair graying and it's really a shock. आप अगर अपने 20s में हैं या 30s में अभी गए भी नहीं हैं, you're below 30 और अगर सफेद या ग्रे हेयर दिख जाता है तो वाकई में लगता है कि अरे ये क्या हो गया एंड डेफिनेटली ये हमारे साइकोलॉजिकल हेल्थ को बहुत इम्पैक्ट करता है. तो ऐसे में सबसे पहले तो ये जानना चाहेंगे डॉक्टर, व्हाट इज प्रीमेच्योर ग्रेइंग ऑफ हेयर?
Yes. See, if we see gray hairs, backwards, अगर हम पीछे देखें तो अगर 40-50 में आपको ग्रे हेयर्स होते थे तो देर इट्स अ साइन ऑफ सीनियरिटी. आप बड़े हो गए हो, सीनियर हो गए हो. What I remembered in my mother and father, if they are getting a gray hair, it's like we अपने बाल सफेद धूप में नहीं किए खड़े होके. It's with the time
राइट,
that we have done this. But
एक्सपीरियंस शो करता था बाल सफेद होना.
yes,
राइट.
I can recall that time. But as I started my practice and what I've seen that even a young generation nowadays are getting a white hairs. So what exactly a white hair? White hairs means if you're losing the pigment, that black pigment on your hair. Okay, and the pigment which gives the black color, and you're losing that pigment, then the loss of pigment will leads to the white hair. And if it is appeared in teenage, in adolescence, or in early 20s, or we can say in early 30s, but or late 20s, we call it premature aging or premature graying of hairs. Okay, so it's supposed to not to be there in their age, but we are losing the pigment in early age, so known as premature graying of hairs.
So that is the premature graying of hair. Um, and what should one do? I mean, has genetic anything to do with it? अगर किसी के घर में family history है premature graying of hair की या जल्दी बाल सफेद होने की, then what should be the person who's at risk should do to prevent it or prolong it?
Yes, you're absolutely correct. Basically, genetic is one of the major factor which has been seen कि अगर आपके parents को जल्दी grey hairs हुए तो आपको भी जल्दी hairs हो जाते हैं. Okay, so that is not an intrinsic factor, aging factor, genetic factor which are getting it. But over that also there are many extrinsic factor which is also adding to it. Okay, and most commonly is the what I can see is a sun exposure or a pollutant, which is basically causing the degradation of, because of pollution there is an oxidative stress leading to the depletion of the melanin. If you just allow me, can I just tell you what is exactly how we develop this melanin in our hair color? If you just like to know about it.
Yeah, sure.
So basically, we have a cells called melanocytes, and these melanocytes, which is been there, which produce the melanin pigment, which gives the black color to our skin and the hair. Okay. Now, if the melanocyte are destructive, they are being destruct by some of the factors, whether it's the environmental factors or the genetic factors, or if the production of the melanin goes down within the melanocytes, then your hair become white in color. Okay. So now,
Right.
what are the factors which leads to depletion of this melanin? Is, as I said, genetic. You have already talked about it. But there, instead of genetic also, now what is the addition? Is the environmental factors. Okay.
Mm.
So if we include the environmental and the genetic factor, that's why we have started getting the premature graying of hairs.
Mhm. And doctor, what do you feel about the awareness level right now? Are people really aware about it or aware about the consequences of the same in future? Because you know what happens, there are so many shortcuts. We
Yeah.
have over-the-counter products, we have dyes, we have colors, and people, rather than going for the root cause, what they find more convenient is to go for these products. And after experimenting, जिसने जो बोल दिया, इन्फ्लुएंसर्स है सोशल मीडिया पे, फ्रेंड्स है, फैमिली है, जिसने जो बोल दिया वो सब हमने एक्सपेरिमेंट कर दिया। बालों में मेहंदी लगा ली, बीटरूट, जो जो मिला, जिसने जो बोला हमने सब लगा लिया। लेकिन क्या उतना अवेयरनेस लेवल है कि हमें ये है तो हमें क्या करना चाहिए? एंड व्हाई इट इज इम्पोर्टेंट टू कंसल्ट अ डर्मेट लाइक यू, अ क्वालिफाइड डर्मेटोलॉजिस्ट, rather than going for quick fixes? ये जो शॉर्टकट्स है, ये कितने हानिकारक हो सकते हैं?
हाँ जी, शॉर्टकट्स हैं। देखिए, फर्स्ट ऑफ ऑल द बीइंग एज एन emerging cosmetic problem, I should say that it's
हम्म।
so people are actually not aware. They get
हम्म।
panicked to see an early premature graying, and what affects is their confidence and the quality of life. Okay, because look is very important. As you said, the black hair is the glory of everyone. uh,
हम्म।
to because the people doesn't have any knowledge, they definitely lack a knowledge about it. So what they do a shortcut, as you said, the hair color application right from the adolescent age, which is
हम्म।
actually a harmful chemical. Okay.
Right.
Which and destroying your melanin further. Okay, and you
Right.
see when you start coloring your hair become more gray. They become more faster graying. You will be seeing it. Okay.
हम्म।
Second thing, either if they start seeing one or two hairs, they start plucking it up. You know.
हम्म।
Now plucking is not the solution, because why it is happening? Because you're losing the color.
हम्म।
Now, will plucking will help in rebuilding the color? No, definitely no.
Right.
In other way, you are just destroying the existing hair follicle where the melanocyte is there, and reduction of melanocytes leads to further graying of hair. Fine. So neither
Right.
the plucking your hairs, neither the coloring your hairs definitely will help you in prevention of graying of hairs. It will make it more further faster.
राइट। अच्छा, जब हम बात कर रहे थे कि क्यों आजकल इतना कॉमन हो गया है कि यंग जनरेशन में भी प्रीमेच्योर ग्रेइंग ऑफ हेयर नजर आने लगा है, तो आपने कहा कि जेनेटिक रीजंस हैं, देन लाइफस्टाइल, एनवायरमेंटल इश्यूज है, लाइफस्टाइल का बहुत बड़ा इशू है।
Yeah.
हेयर इज अ रिफ्लेक्शन ऑफ आवर हेल्थ, व्हाट इज गोइंग ऑन इनसाइड आवर बॉडी इज व्हाट इज रिफ्लेक्टेड ओवर आवर स्किन, स्कैल्प, हेयर एक्सेट्रा। तो एक तरह से वो एक आईना है, हम कह सकते हैं कि हमारी हेल्थ कैसी है। खाने पीने का भी, हमारे डाइट का भी हमारे बालों पर बहुत असर पड़ता है, हमारे स्किन पर बहुत असर पड़ता है। एंड व्हाट वी आर सीइंग दीज डेज, सबको एक पर्टिकुलर फ्रेम में फिट होना है। तो उस चक्कर में कई बार हम अपना डाइट स्किप करते हैं या बहुत रिग्रेसिवली फॉलो करते हैं, क्रैश डाइटिंग एक्सेट्रा। तो ऐसे में न्यूट्रिशनल डेफिशिएंसी हो सकती है क्या, और उसकी वजह से प्रीमेच्योर ग्रेइंग ऑफ हेयर हो सकता है क्या? हाउ इम्पोर्टेंट इज डाइट?
It's very, very important. It's a crucial part for your hair, because if you're losing your diet, if you're not taking a balanced diet, if you're skipping your breakfast, if you're doing a crash diet, that means you are not taking a proper nutrients and minerals, which is exactly been required for your hair growth. Okay. Example, vitamin B complex, zinc, copper, mineral, and selenium. These are very minute minerals. If you take a daily good balanced diet, you will able to take it. But because of the lifestyle modification, more of a junk food, which is easily available junk food, okay, and so we are actually compromising on our diet. What is leading to? It's leading to the imbalanced diet, and because of the deficiencies of the important vitamins and minerals, which are easily available if you take a balanced diet, we are getting premature graying of hair. So lifestyle, definitely. And to add on, smoking and alcohol is further which aggravate this problem.
राइट। तो एक हेल्दी डाइट जरूरी है कि हम स्मोकिंग, अल्कोहल इन सब से भी दूर रहे, और तभी हम भी हेल्दी रहेंगे, हमारे बाल भी हेल्दी रहेंगे। डाइट की चूंकि हमने बात की और आपने बताया कि कितना इंपॉर्टेंट है कुछ माइक्रो न्यूट्रिएंट्स विटामिन ये हमें मिलते रहे, और इसके लिए बहुत जरूरी है हम रेगुलरली एक डेली बैलेंस डाइट, हेल्दी डाइट फॉलो करें। लेकिन
Yes.
होता ये है, जिस तरह से अभी बहुत आम होता जा रहा है जंक फूड लेना या क्रैश डाइटिंग एक्सेट्रा एक्सेट्रा, वैसे ही बहुत कॉमन होता जा रहा है सप्लीमेंट्स लेना, गमीज लेना
Yes.
बिना डॉक्टर की सलाह के, बिकॉज दे आर अगेन वेरी इजीली एक्सेसिबल, अवेलेबल। आपको किसी प्रिस्क्रिप्शन की जरूरत नहीं पड़ती, आप ई कॉमर्स साइट से भी मंगवा सकते हैं। एंड गमीज, आई मीन टू बी वेरी स्पेसिफिक, आजकल बहुत ट्रेंड में है। तो व्हाट्स योर
Yes.
टेक डॉक्टर, स्पेशली बिना डॉक्टर की सलाह के, बिना ये जाने कि हमें इसकी डेफिशिएंसी है भी या नहीं, बायोटिन सप्लीमेंट, जिंक सप्लीमेंट, आयरन सप्लीमेंट, क्योंकि सबको पता है ये जरूरी है बालों के लिए, तो ले लेते हैं, गमीज ले लेते हैं। व्हाट्स योर टेक ऑन दैट?
See, I'll tell you, I have many patient मेरे पास आते हैं patient की डॉक्टर हम तो multivitamin ले रहे हैं. So what is the importance of giving? If I write the blood test also to them, so I'll then let me check your blood levels of your vitamins. So when I check their vitamins level, they are actually deficient of an important vitamins which I really need for the hair to grow, okay, or to
हम्म।
prevent the premature growing. So
हम्म।
how much micronutrients the daily requirement you are taking the gummies because you are not aware of how much daily requirement is required. You're just buying
राइट।
because it's written on the gummies or the multivitamin that it has zinc, copper, and you're just having it. So, what
हम्म।
quantity you're taking? Are you aware of that? And which ingredient is more important when you're facing a particular problem, right? Also, there is something called malabsorption. If you have vitamin B12 deficiency, that doesn't mean that you're taking it and you're still absorbing it. There are certain factors where you have malabsorption, and whatever supplements you're taking, it's not been absorbed. So there are multiple factors that sometimes we have to look. Even if you're taking multifactorial, are it just proper in the way it's supposed to be, or whether your body is able to absorb it in or not. So meeting a dermatologist makes you perfect that you're taking in a correct quantity in a correct way and the requirement which is there supposed to be. So it's definitely an OTC product will not help you for a long time.
राइट। अच्छा, चूंकि हम खाने पीने की बात कर रहे हैं, विंटर्स आर हियर एंड विंटर्स आर सपोजिटली द बेस्ट टाइम टू बूस्ट अप योर हेल्थ, बिकॉज इतना वेजिटेबल, ग्रीन लिफी वेजिटेबल, सिट्रस फ्रूट्स, फ्रूट, ये सब मार्केट में अवेलेबल है कि इस टाइम, और बॉडी आराम से खा भी लेती है, डाइजेस्ट भी हो जाता है। सो व्हाट आर द थिंग्स टू लुक फॉरवर्ड टू, स्पेशली ड्यूरिंग दिस वेदर, जो हम खा सकते हैं और अपने बालों को हेल्दी रख सकते हैं, प्री मैच्योर ग्रेइंग ऑफ हेयर से बच सकते हैं, वो कौन सी चीजें हैं?
Yes. See, you should add a lot of now spinach, green leafy vegetables are easily available in winters. Okay, so spinach is a good source of iron. You can add another source of multi-minerals. Then beetroot is easily available in this season. Carrot is easily available in this season. So that you can. And then when I'm talking about antioxidant, you can have oranges. You can have the citrus food also you can include in your diet, which gives you vitamin C as well in a lot of quantity. Amla is also available very nicely over these days, and people think that amla is so important for your hair. So this is the season when you actually put amla in your diet. Second, if you ask me the other superfoods which should be there in your diet is like seeds should be added in your diet, like pumpkin seeds is very important. So this is the season, peas are matar bahut easily available hai. Then again, so all seasonal foods, winters is a rich of vegetables and fruits. So if you add on the, all colors of the fruits and vegetables in your diet, capsicum you can add, bell pepper, source of antioxidant. So this is all which you can include and you can make your hair glow.
वाह, तो ये सब हम खा सकते हैं अपने रेगुलर डाइट में, इस वक्त इंक्लूड कर
And
सकते हैं एंड दैट
one more to add on egg. लोगों को गर्मियों में लगता है कि एग जो है गर्म होते हैं, but in this season egg is itself is a complete food which you can add on.
वाह, तो ये वो तमाम चीजें हैं जो हम इंक्लूड कर सकते हैं अपने डाइट में। जब प्री मैच्योर ग्रेइंग ऑफ हेयर से परेशान लोग आपके पास आते हैं, पेशेंट्स आपके पास आते हैं, तो सबसे पहले रूट कॉज पता करने के लिए या क्या उसके लिए किया जाता है? क्या आप टेस्ट भी एडवाइस करते हैं, या जस्ट बाय योर टेकिंग द हिस्ट्री और क्लिनिकल ऑब्जर्वेशन यू कैन से कि क्या दिक्कत है?
History is definitely an important, as you said, most of the time genetic. So if it is genetic, I have to counsel my patient that why you are developing it. And of course, the diet, as you said, so diet, we have to test some vitamin deficiency also for the patients. And if there is some autoimmune problem, sometimes you have some autoimmune problem like thyroid or they have vitiligo. So that also we have to look into it, some skin problem associated with it. And when I conclude to it, then I'll start the treatment according to what would be the cause for the premature growth.
एंड ट्रीटमेंट ऑप्शंस क्या क्या होते हैं डॉक्टर?
When it treatment, so right now we have the tablet also, which is specifically meant for treating your premature graying. And if I'll tell you, if you come in at early age, for example, if you are getting a premature graying in your adolescent or late teens or early 20s, it is reversible. We can make it reversible now with the treatment. Okay. And so that people really doesn't know. They think when in late 20s and early 30s, if you start taking the treatment, you can prevent further premature graying, right? So there are tablets available, which is like calcium panthenate. And if you take in a proper dosing, that again a vitamin, which will help in prevention and even reversible of your hairs, white hairs at an early age. Also now available is the serums, which you can apply on your hair roots, and that will help in redeveloping of the melanin pigment, and then you will get your black hair back. Okay.
Wow. So yeah, I think is a good news that, if you go early to consult a doctor, a qualified dermat, then of course they'll restrict it, find out the root cause, etc., etc. Plus, reversing the whole process is also possible these days. तो ये एक अच्छी खबर है. तो इसीलिए मेरे ख्याल से bottom line ये है कि rather than going for home remedies or wasting your time on, coloring your hair and trying other methods and going by whatever whoever is saying, please go to the right person, go to an expert, which is a qualified dermatologist. They have studied, they have studied our skin, our scalp, our hair, and of course they know what is the right thing. कई बार होता है हम बहुत सारा पैसा, एनर्जी, टाइम और अपनी हेल्थ वेस्ट कर देते हैं या रिस्क करते हैं, और अल्टीमेटली हमको एक डॉक्टर के पास ही जाना पड़ता है, लेकिन अगर हम पहले चले जाएंगे तो चीजें इतनी कॉम्प्लिकेटेड नहीं होंगी एंड फर्दर हम इससे बच सकते हैं। कलरिंग चूंकि एक बहुत बड़ा इशू है डॉक्टर, वही सबसे इजीली अवेलेबल शॉर्टकट है। चाहे वो प्रीमेच्योर ग्रेइंग ऑफ हेयर हो या जब एक नॉर्मल नेचुरल प्रोसेस के तहत ग्रेइंग ऑफ हेयर होता है, people normally prefer coloring, and coloring के लिए many a times they'll go to a salon or a parlor, or they'll go buy the colors by themselves and start, coloring their hair or get it done by someone. What I'm trying to ask you is, in case people are going for coloring, A, we are telling them don't go. I mean, in case you have this issue, go and consult a doctor. But even if they are going for it, what are the ingredients to, check जो उसमें ना हो, मतलब बहुत ऐसे harmful chemicals ना हो जो further और problem कर सकते हैं. So what are the things to look for, or what are the things to avoid?
See, definitely it should be ammonia free. Okay.
Hmm.
As not only now, what I have seen, what is ammonia, like PPD and ammonia hair colors are, they are more permanent. Okay. Now, later comes the ammonia free, which is the semi permanent one. But it has also the molecule which will damage your hair. Fine. So there are hair color with ammonia. Now people are going to a no ammonia, no PPD, no ammonia hair color. But the color which has been chemical which has been used in for those hair dye or a hair color is again going to damage your hairs. So now we are coming up with the more safer hair color. Though I don't prescribe the younger age group for going for these colors, but if a patient is coming from late 30s or early 40s, which is like they want to color their hair, for white hairs, I'm talking about. Okay. So then we have the color which are more safer in dermatology also to apply. Okay. And which is ammonia free and PPD free. Right. But if you want to go for, younger age, they want to go for streaking.
Hmm.
In that case, again, I'll tell don't go for the easily available saloons hair color. And we have now in dermatology also, according with the guidance of a doctor, you can get those colors if, anyways, if you want to, because
Hmm.
sometimes teenagers they want to get it done. So my suggestion is definitely it should not be it should be ammonia free as we because which is a very harmful it's when what does the ammonia will do it is forming an ammonium peroxide which will open up your cuticles so when it
Hmm.
opens open your cuticles basically you're losing your melanin from the gray hair also and from the hair which are black because when you open the cuticle the hair is not able to hold the melanin pigment so better not to go for it. But if you're going, again, there are very safe hair colors. Ask your dermatologist.
When a person comes to you and asks you that I'm going through this, and of course it do affects the psychological health as well, जो initially हमने बात की थी, क्योंकि especially जब आप अपने 20s में हैं, अपने adolescence में हैं, तब सफेद बाल होना is a big shock. तो ऐसे में क्या mental counseling भी आप करते हो? Because वो भी I'm sure एक important part है.
Exactly, you're absolutely correct because it definitely disturbs the quality of life of a patient because the premature graying or the graying of hair that is not the one which is supposed to be there. So I counsel the patient. I counsel the patient why you're developing it, if it is genetic and is other factors are there, how to take care of the hairs, what precautions you have to take what extra foods or balanced diet you have to take and so with the counseling the patient will understand and now with the treatment patient when start seeing the results they gain the confidence okay and so counseling is definitely an important part to make them understand why they're developing and the treatment is
Definitely. So counseling is an important part. We have few questions from our viewers as well. I'll take one of them. So Ria Sathi is here, and her question is there a connection between premature graying and the use of specific type of hair accessories?
hair accessories can you just elaborate on hair accessories.
हाँ, इन्होंने लिखा नहीं है, लेकिन मुझे लगता है कि हेयर एक्सेसरीज से ज्यादा जो हेयर इंस्ट्रूमेंट्स होते हैं, डिवाइसेस होते हैं, लाइक ब्लो ड्राइंग या स्ट्रेटनर्स एक्सेट्रा, उससे भी फर्क पड़ता है क्या डॉक्टर? बिकॉज रैपिडली पीपल आर यूजिंग दीज थिंग्स.
Absolutely correct. So if we are doing too much of a styling, we are doing a lot of heat application or a blow dry application, definitely your hair become dry, brittle. And once if your cuticle is disturbed, as I said in chemical treatment, what is disturbed is your cuticle, which basically hold the melanin. Yes, you can develop premature graying if you are doing a lot of styling on your hairs. Definitely.
हम्म।
It
आजकल लोग अपने बालों को वर्जिन रहने ही नहीं देते हैं, दे आर ईदर गोइंग फॉर इवन पीपल एट वेरी young age, they'll go for
go dry.
hair straightening, perming, etc. So a lot of chemicals goes in. So do these chemicals play a lone role in premature graying of hair?
Yes, definitely. Studies has been done and has been confirmed that more of the chemical is being exposed to the hair follicle. It will disturb your hair follicle as well as the melanocytes, which is present in the hair follicle, which is giving the color. Okay, so that oxidative stress and the reactive oxygen which develops is damage your hair follicle as well as the melanocytes, leading to premature graying of hair and loss of hair. Definitely.
राइट, तो बालों को लेकर यहाँ बात हो रही है, प्री मैच्योर ग्रेइंग ऑफ हेयर को लेकर यहाँ बात हो रही है, और बहुत जरूरी है कि हम ये समझे कि अगर प्री मैच्योर ग्रेइंग का इशू है तो सबसे पहले हमें एक डॉक्टर के पास जाना चाहिए। हमें अपना वक्त नहीं जाया करना चाहिए ओवर द काउंटर प्रोडक्ट्स पर, या लोग क्या कह रहे हैं, क्या लगाने को बोल रहे हैं, होम रेमेडीज किस तरह से वर्क कर रही हैं। बहुत सारे होम रेमेडीज पर अगर मैं बात करूं तो बहुत सारे कॉन्कक्शंस के रेसिपी लोगों के पास है कि आप प्याज के रस के साथ तेल बना लो, कलौंजी, अनियन सीड्स, उसका तेल यूज करो, या कड़ी पत्ते का तेल बना लो, एंड दे ऑल विल वर्क। एंड एक्चुअली पीपल एंड अप वेस्टिंग अ लॉट ऑफ टाइम एंड एक्सपेरिमेंटिंग विद दीज things. So what's your take on these home remedies, doctor? Do they work?
So, if you ask me for premature graying, exactly not. Okay. But if you want to make your hair healthy to a certain extent, yes. Okay. Because they are natural products. So, if you're putting oil on your hair, right, what does the oil will do? It will do a little moisturizing effect to your scalp and hair, which will
Hmm.
prevent in further drying, which has been there because of chemical use, right? And so if we prevent, if we keep our hair moisturization is there, so your hair looks more healthy, non-frizzy. So that's why they're helpful in a certain extent, but not for premature graying, because premature graying is because of the loss of the melanin, and
Hmm.
able to develop the melanin there, right? So
Right.
helps in maintaining your hair moisture, but not the melanin.
आई थिंक ये भी एक अच्छी सीख है, क्योंकि वी एंड अप वेस्टिंग अ लॉट ऑफ टाइम इन प्रिपेयरिंग दीज एंड देन अप्लाइंग देम एक्सेट्रा। ऑयलिंग को लेकर मेरे ख्याल से डॉक्टर थोड़ी और अवेयरनेस की जरूरत है भी, क्योंकि हमारे सोसाइटी में ऑयलिंग को काफी हमने ग्लोरीफाई किया है। हमें लगता है बालों में अगर हम तेल लगा लें और घंटों से बालों में, स्कैल्प में रादर रहने दें, तो वो हमारे बालों के लिए बहुत अच्छा है। तो ऑयलिंग या मसाज, रिगरस मसाजिंग ऑफ योर स्कैल्प, और इस तरह से बहुत देर तक तेल स्कैल्प पे लगे रहना, ये क्या वाकई में इफेक्टिव है या इसके साइड इफेक्ट्स हो सकते हैं?
आई थिंक इसकी साइड इफेक्ट ज्यादा है इंस्टेड ऑफ हैविंग इफेक्टिवनेस, बिकॉज अगर आप बहुत ज्यादा ऑयल अपने हेयर पे रखते हैं, तो आपके जो पोर्स हैं वो बंद होते हैं, ओके, अननेसेसरी फंगस ग्रोथ बहुत ज्यादा होती है, राइट, उसे।
हम्म।
और अगर आपको डेंड्रफ है तो आपका डेंड्रफ बढ़ जाता है, because you're not able to clean your scalp. Okay, you're putting so much of oil. और अगर आप एक्स्ट्रा ऑयल लगाते हैं तो फिर आप एक्स्ट्रा शैम्पू भी लगाते हैं उसको क्लियर करने के लिए, दैट्स you're putting more chemical on your hair कि whatever extra oil you have put, now you want your that extra oil to be flushed out. Second, if you have an oily scalp or a oily skin, you start developing acne or pimples or even folliculitis, infection of the hair follicle. So oiling is important if you definitely, but not for keeping it for some days and overnight. I always tell my patient keep it for half an hour and 1 hour. Just moisture your scalp with the oil and wash your hair.
बिल्कुल। तो इसे एक प्री हेयर वॉश कंडीशनर की तरह हम यूज कर सकते हैं। तो
Yeah.
पहले तेल लगा ले बालों में एंड देन गेट इट वॉश, देन वो एक एक्स्ट्रा लश्य आपको जरूर मिलेगा। एक हमारी व्यूअर है फारिया बेग, उनका सवाल है, कैन एक्सपोजर टू सर्टेन टाइप्स ऑफ पेट्स और एनिमल्स इम्पैक्ट द लाइक्लीहुड ऑफ प्रीमेच्योर ग्रेइंग?
No,
इसका भी कोई रिलेशन नहीं?
not direct. I don't think so. Yeah.
ओके। तो प्रीमेच्योर हेयर पर हम बात कर रहे हैं, और हेयर केयर पर भी हम थोड़ी बात करना चाहेंगे डॉक्टर, कि प्रीमेच्योर ग्रेइंग अगर नहीं हो या उसे प्रोलॉन्ग करना है या हमें अपने बालों का ध्यान रखना है इन जनरल भी, तो हमें क्या कुछ करना चाहिए?
Exactly. So we are living in an environment where we have to deal with the pollution, okay, and also we have to keep in pace with the fast speed of the life. Now, what is important is balanced diet. Look for a balanced diet. How you can have a balanced diet, and look, important part is go for the superfoods in your diet. Add the superfoods. What are superfoods? We have, you can, the very simple one, as I said, egg, and then you can have the seeds, you can have nuts in your diet. Okay, so these are the small things which we don't keep in our mind. We have chips, don't have chips, have nuts. Okay, that's the better fast way of.
Right.
So, and you can have the makhana in, you know, बहुत जल्दी नमकीन खाते हैं. Don't have those नमकीन. Have makhana. Make some sprouts in your, that you can add between in mid meals. Okay, so that is a good source. So good balanced diet is very important. Also, when you are using shampoos, try to have a sulfate free and paraben free shampoos. Don't overdo shampooing is also not important, is you know, being a chemical. So do a good hair care, and whenever you're going out for us in a, you know, sun or something, like in a beach or for a outing, then put a hair cap or a scarf, so that environmental factors should not damage your hair. So, you know, a little extra precautions if you take in a diet, we're looking for environmental factors and stress. So excessive stress also leads to premature graying, right?
Right.
You
Hmm.
have to take care of your stress level also. And if you just follow these, you will prevent premature graying.
सो आई थिंक लाइफस्टाइल मॉडिफिकेशन अगर हम थोड़ी बहुत कर ले, हमारे डाइट पर हम ध्यान दें, हम जो ये इन बिटवीन स्नैकिंग होता है इसके ऑप्शंस थोड़े इधर उधर कर ले, जैसे कि डॉक्टर ने टिप्स दिए हैं, स्ट्रेस लेवल को कम करने के लिए किसी एक्टिविटी में हम अपने आप को इन्वॉल्व करें, अच्छी स्लीप ले, अच्छी नींद ले, थोड़ी बहुत एक्सरसाइज करते रहे, इट्स इम्पॉर्टेंट टू स्वेट आउट। तो ये सब अगर हम करेंगे तो भी विल गो अ लॉन्ग वे इन मेंटेनिंग गुड हेयर हेल्थ। तो ये सब हमारे हाथ में है, ये हम कर सकते हैं। और इन केस फिर भी हमें प्रीमेच्योर ग्रेइंग ऑफ हेयर का इशू है, तो डेफिनेटली डॉक्टर्स है, क्वालिफाइड डर्मेटोलॉजिस्ट है, rather than going for quacks etc, we can very easily safely go to any qualified dermat that will really help us. And doctor, before we sum up the whole session, any take home message for our viewers?
Yeah. So the take home message, as you said, if you want a good black glow, glory on your hair, so follow the tip which we have just discussed: good diet, healthy lifestyle, regular exercise, and meet a dermatologist if you still face a problem.
बिल्कुल। तो अगर स्कैल्प है, स्किन, इससे रिलेटेड कोई भी इशू है, तो प्लीज एक डर्मैट के पास जाइए, rather than going for home remedies or over the counter products. You'll end up wasting your money, time, energy, everything, and your health will be at risk as well. So please don't go for all these shortcuts. Shortcuts always have a bigger route. So go to the right person. Thank you so very much, Dr. Chanchal. It was wonderful talking to you. Thank you for all the insights. And I'm sure your tips will be very helpful for our viewers. Thank you so very much. And viewers, thank you for your active participation in today's session.
Thank you. Thanks a lot.
Thank you, Doctor.